When you take these GLP-1 medications, a lot of people ask, am I supposed to feel better? In theory, when you take a GLP-1 medication, you should either notice improvements in energy because it's anti-inflammatory, right? Or you'll notice no change at all. If you notice after a couple of weeks of starting GLP-1s that your energy crashes, it's probably because you got that metabolic downregulation, you started eating less, and that's why it's cranking down your energy. Remember, energy is protein, fat, or carbohydrates. It's all, at the end of the day, energy, right? And if you end up consuming any amount of energy in surplus of what you consume, that will contribute to weight gain. And it's your hormones that dramatically influence what that weight and also what you're doing, right? So bodybuilders are a perfect example, but anybody that is gaining weight could be gaining all muscle, which is super good for you. Unused protein being turned into fat. So let's talk about that, especially because I am in favor of over recommending your protein needs, right? So you've heard me talk about my range of my recommendations of protein being between your current weight and your target weight in grams of protein. That's what we should be striving for. So 200-pound person who ideally should be weighing 150 should be consuming about 150 to 200 grams of protein. Now, we know that significantly is much more than RDA recommendations, but they're so far behind the data. So do I think our body actually needs that much for just maintaining muscle mass and muscular growth? Probably not. I say probably not. But the problem is people always tend to underestimate their protein. That's why I've always been a little bit more like, just overshoot it. There's no dangers with slight overconsumption of protein. Now, I know we're talking about the question that was asked was, does it get converted into fat? And I'm getting there. With the exception of actual known kidney disease, which you'd be working with a nephrologist anyways. If you don't have that, any additional protein is just going to get converted into energy. Okay. Now, let's connect it to fat. Any energy that you consume that's in excess, remember, energy is protein, fat, or carbohydrates. It's all, at the end of the day, energy, right? And if you end up consuming any amount of energy in surplus of what you consume, that will contribute to weight gain. And it's your hormones that dramatically influence what that weight and also what you're doing, right? So bodybuilders are a perfect example, but anybody that is gaining weight could be gaining all muscle, which is super good for you, right? If you're putting in the weight training, you're creating that stress, you're in a slight surplus, you're consuming adequate protein, right? That would be an example where you're putting on mostly muscle mass. But aside from that situation, if you're consuming excessive amounts of protein, but you're not really in a surplus, you're not going to gain body fat. So keep that in mind too as well. And the chances of over consuming protein and whether it's protein powders or meats in a way that puts you in excess of calories, it could happen. Don't get me wrong. It could totally happen. But the chances of overeating protein are significantly lower than overeating carbohydrates, bar none. You guys, even fatty steak, which is pretty calorically dense, how much fatty steak can you eat before you're sitting there going, oh my God, I am insanely stuffed? That's the thing. That's why ketogenic diets and carnivore diets, like we're talking about some fatty meats there and high amount of calories, but it's pretty challenging to overeat that compared to carbohydrates, which don't really hit the satiety center nearly as much. At the end of the day, don't freak out. Don't worry about extra protein. In almost every case, it's not going to be converted into fat. Technically could, just wanted you to understand that it very likely won't. Carlos, I've been taking colostrum for maybe 9 months, and it has been a game changer for me. That's fantastic. Carlos, if you just mind sharing, what have you noticed? Because like I said, colostrum could be pretty awesome for some people, for sure.
I think it's Carol's.
Yeah, that's what I'm actually correcting myself. Good job. Carol, if you want to share.
Yeah, so it's been at least 9 months, maybe even more. And I have tons of gut issues. The past year, I've been really good on my gut. Like I used to lay around half the day with like lights on my belly and from pain and stuff. And I've been taking that colostrum and man, I don't even do that anymore. I don't even have the lights on my belly anymore. And
Awesome.
I think I can eat more foods now too. And I don't try to go crazy, but I can eat a little bit of things. And my hair, I started noticing
Growing your hair.
my hair really I got it cut and he thins it out now.
That's awesome.
So
No, that's
I sent it to my sister who's having some hair loss issues, and because it's really and my energy, it helps with energy too.
energy. This is a big one. My gosh, energy. Why am I so tired? I have a lot to say about energy. I think energy issues are probably one of the biggest complaints that I think most people have as far as symptoms in general, not even in weight loss, but just overall health, optimizing my energy. My gosh, if I just had more energy, how much more productive would I be? For sure. And that kind of goes along with brain fog too. Very similar. They're different symptoms, but they tend to go hand in hand. So there's a lot of things that can impact your energy level. So I think it's important you guys understand that, because hopefully I've been able to inspire you guys, if you weren't already, on a mission for optimal health, right? Not just lasting weight loss, but you want to optimize your health, because how much better would it be if you weren't just at a healthy weight, but imagine if you felt like a rock star every day and that was just normal. But you did at one point, right? So that should be the goal. And I truthfully believe we can help you get there with all the different tools and strategies. There's 10 pillars of lasting weight loss, because I've added mindset in recently, but and I know it's a lot for you guys that are just starting. Just one advice I can give you guys, and then we'll get back to energy, especially for my newbies here, is if it does seem overwhelming with the 10 pillars, just start with a handful of pillars that you're comfortable with. Usually the nutrition and the fasting, like really sink your teeth into that, and the keto, and then expand on the other ones, and as whenever you comfortably can. That's just a little side note. But yeah, energy, we need to understand that there's so many things that can impact energy levels that would keep us from feeling optimal. Let's start with hormones. And in fact, two hormones come into mind. So we have thyroid and we have testosterone. So thyroid is interesting because you also have the weight loss plateau phenomena, which is a little bit of a thyroid issue, but it's not the same thyroid issue. So let's dissect these two parts and understand it. So we have true hypothyroidism, which means it's not a weight loss plateau issue. It's just your body is not making enough thyroid hormone. Now, that can get dissected into many pieces. And if you are working, I used to do, as you guys know, some of you, I used to do functional med as a background. That's how I've come up with a lot of these protocols. But if I was still working with a person in a functional space, we would really dive deep and try to figure out why you're hypothyroid. And in some cases, actually fix it. It's really challenging, really expensive, really exhaustive journey that sometimes gets nowhere, which unfortunately, that's why I got out of it, because it was a little frustrating. But some people, true hypothyroid situation, if you don't medicate, you won't go anywhere. Your quality of life will suffer. Thyroid really is the master hormone. Every single cell in your body has a receptor for thyroid. So your ability to even get more healthy, even if it has nothing to do with weight loss, if you feel like crap and you have low thyroid, that's one of the first things you need to fix, because every cell has thyroid. So every cell is not cranking as much energy to do the things that it would needs to do outside of even weight loss, and you won't heal. It'll be much tougher. So getting your thyroid balanced is a huge thing that will dramatically impact your energy levels. Now, the weight loss plateau phenomena is where, as you guys many, we covered this in the beginning, so I won't waste too much time, but it's that calorie deficit. If it's large enough and it's over a long enough period of time, you get this down regulation, which is, the effect is similar to a hypothyroidism. It's a little bit different, reverse T3 raises and a couple other nuances. And you don't need medication. You guys know the reverse diet, we fix it, but it does look like a hypothyroid. And one of the main symptoms is tiredness, exhaustion. So I'm going down the list, guys, so you guys can have a checklist if you're trying to fix your energy. So we have true hypothyroidism. We have the weight loss plateau. Then we have testosterone. So testosterone, suboptimal and low testosterones, one of the hallmark symptoms is tiredness and brain fog. So this is something that you can check on labs, but truthfully, if you have half or more of the following symptoms that I'm going to list off, then definitely let us know if you want us to check your testosterone, but you should go get that checked out, because the quality of life is dramatically improved with testosterone. Testosterone always has that, even though thyroid is more important in terms of every single cell in your body is getting affected by thyroid. Testosterone is the one that is the hormone that, like, yeah, like the changes are Like you'll feel better with thyroid, but when you get on testosterone and you've been low, this is your, so let's go through the symptoms and you'll know what I mean. So symptoms of suboptimal and low testosterone: lower energy, brain fog, loss of muscle mass, less response to the workout, some fat storage, some belly fat storage, increased anxiety, increased depression, loss of motivation, loss of confidence, loss of drive, just overall drive for life. And then a late stage, it can create erectile dysfunction from it. So those last four symptoms are the ones that I was really like showcasing as when you get that fixed, when you go from a situation where you have no drive, you have no motivation, you feel like you're fighting yourself every day to just drag your feet and get through the day. A lot of you got a lot of us can be in there. Yes, you can have high stress that can do that short term, but outside of that's horrible. And how can you focus on lasting weight loss and making changes when you're dealing with that? So that's why testosterone always has, there's a lot more excitement over getting your testosterone fixed for sure. But technically, I wouldn't do it without fixing your thyroid. And I would actually fix your thyroid first if you couldn't fix both, because the ramifications of thyroid are really important. So we covered thyroid, we covered testosterone. So now we have inflammation. Inflammation, when high, can also cause lower levels of energy. And inflammation is sometimes an easy fix, just change your diet. And sometimes you're chasing this inflammation and you can't figure out what it is. Common causes of systemic inflammation, obviously, we just talked about diet being one of them. If you have an autoimmune, if you have some sort of inflammatory condition, that's going to drive your inflammation up. Toxic exposures, this can be mold in your house, this could be gut infections that you don't even know you have, or parasites. This can be certain chemicals and products that you're using that you don't even realize that your body's reacting to. And the whole class of toxicity is an entire class itself, but the end result is more inflammation to the body. So inflammation really is its own journey too as well. And the supplements as well that we recommend, not having adequate phytonutrients in your body is inflammatory. High blood sugar is inflammatory, right? We're targeting those. We're fixing those, guys. We're fixing your blood sugar. We're getting you guys, the diet part is fixed. The micronutrients are going to be fixed. So really, if you're doing this program and we've already checked your thyroid and you're not in a plateau and you're still struggling with energy, then maybe it's cortisol, which we're going to talk about next, could be a place to start too as well. And we do cover cortisol as one of the pillars, and that's more of that stress related cortisol, but we'll talk about that next. But that's really it. When you take these GLP-1 medications, a lot of people ask, am I supposed to feel better? In theory, when you take a GLP-1 medication, you should either notice improvements in energy because it's anti-inflammatory, right? Or you'll notice no change at all. If you notice after a couple of weeks of starting GLP-1s that your energy crashes, it's probably because you got that metabolic downregulation, you started eating less, and that's why it's cranking down your energy. And I know some of you were asking that question, so I wanted to clarify the relationship between GLP-1 and energy. So finally, stress. So stress and sleep, those are the last two. So chronic stress, chronic cortisol spikes can dampen your energy. So that's one aspect to check. And then, of course, the big one, not getting quality sleep, 7 to 9 hours of quality sleep. This is why we cover those. There's always the last pillars I talk about, but those are important to understand. So just work your way down this list, guys, one at a time, hit that, get it fixed, see what that does for your energy, and then move on from there. All right. Saw a couple questions come in from that one. New patient here, Andrew. I already know my T count is low and I've had it tested. I've done a large mix of supplements and weightlifting, but to be frank, nothing really helps. Given a genetic heart condition, it's been rather difficult to have my medical professionals want to supplement. So yeah, we would have to look into whatever heart condition you are referring to for sure. So let's keep that separate. It's extremely challenging to fix low testosterone with supplements. Can it happen? A little bit of an increase in testosterone, but to the degree that we need to get optimal, it's almost never going to happen without actual hormone therapy, TRT, testosterone replacement therapy, with bioidentical testosterone. Definitely, you can reach out to us on the FLOA hotline. We can set you up on a consultation and we can dig deeper to figure out if you can be on testosterone therapy or not. It would totally depend on what sort of condition you have going on. Looks like Ceci already reached out to you, so that's great. Jen, women can have low testosterone. Absolutely, they can have low testosterone. By the way, ladies, did you guys see important update for women? The Women's Health Initiative trial finally came out and they go, whoops, my bad. It doesn't cause cancer for women. Sorry. They didn't say sorry, by the way, but this is what they're obviously to some degree saying, sorry, for the last 30 years, making you suffer by freaking out your doctors and telling them to that this causes cancer. This is such a big deal. And so doctors freaked out. If you guys don't know the whole story, that's what happened over 20 years ago. Prior to that Women's Health Initiative trial, doctors prescribed bioidentical replacement, estrogen and progesterone for women in menopause. And it was known to be very effective and very safe. And it ended suffering for most women. And then all of a sudden, the study comes out. And I don't want to get into my rant because it's pretty crazy when you actually see. I 100% believe that study was done poorly the way it was. That was not an accident. I can be raw with you guys like I can on my lives. That was complete and purposefully done the way they did it because they knew damn well there was so much money they were losing to women that were on bioidenticals. So they purposely created a study and designed it in a way that was very poor. That's my strong opinion. I don't have evidence for that. I'm just speculating that there was strong ulterior motive. But anyways, now literally, and this just happened May 31st. This is how new this is. A couple months ago, they came out and said, okay, we're not going to say it's actually good for you. They still won't say that. Good for you being like, we know it's protective against so many different various like cardiovascular issues and things like that. But they won't say that, but they're finally saying, okay, it's not dangerous. And what blows my mind, not really because I'm aware of the corruption that exists, but you would think something this big would be publicized. This message should be blasted everywhere. Every woman in this world deserves to know, hey, if you're suffering with menopausal symptoms outside of financial situations, you absolutely should be on this therapy because it will likely end your suffering. But of course, the world we live in, the country we live in, they're not going to blast that information. And so many women are never going to know this. And they're going to continue to think that it's dangerous until enough time probably passes. But anyways, I just thought that was insane. That not surprising, but still crazy. Scarlett's been on testosterone and it's been a life changer. It's pretty amazing, Scarlett. It really is. I don't know. You're not working with us, correct? You're working with another clinic?
I just have whatever's left over, and as soon as I run out of that with the other clinic, I'm gonna switch to you guys.
Oh, cool.
But
I was
yeah,
going to
go
go
ahead.
ahead.
What were you gonna say? Oh, no,
Oh,
I just can't believe like I was never someone who could get up in the morning, and as soon as I started taking testosterone, boom, I'm out of bed.
it really is a game changer for men too as well. What I was going to say for women though is here's what I've seen in these clinics. They are cranking women's testosterone too high because the big concept in the hormone world is don't chase the blood results, chase the symptoms, which makes a lot of sense. Because if you're focusing more on symptoms and less on the ideal number, you can generally sometimes get away with a lower dose. And the patients, I feel awesome. Great. Stop there. Don't keep cranking it up. That should be that's how we treat GLP-1s too, right? Because too much hormones can be a problem. But unfortunately, a lot of these TRT clinics, since they're not doing the whole lifestyle like we do with the GLP-1s for weight loss, it's what I'm noticing is they have to crank women's testosterone levels like much higher to get that feeling because the women are inflamed, they're overweight, and so they're driving those hormones much higher to make them feel good. But if they actually focus on weight loss and reducing inflammation, that frees up the receptor sites to be much more sensitive to testosterone. So you wouldn't need as high of a dose. And just like GLP-1s, if you can get away with the benefit of having lower testosterone, that's always going to be better long-term because we keep those receptor sites safe. We don't have some of the other side effects that can happen with women. It's much more delicate because it's like much lower level of testosterone than men. That's a big piece. But no, that's good to hear. Just we're definitely here for you whenever you're ready, for sure.
Yeah, as soon as I run out, I'm coming over.
Awesome. Awesome. Andrew, I have access to get TRT without a prescription 2 blocks from my place. Be careful. Getting testosterone without a prescription in Puerto Vallarta. Yeah, a lot of people can do that, Andrew, but be careful with that, please. Exactly, especially if you have a heart issue. Andrew, definitely let my medical team evaluate that and help you, at least to the best of our ability, try to keep you safe. So as of this very moment, I don't know how close we are. So to us not having access to tirzepatide, which is pretty crazy. We will still have access to semaglutide. We'll still have access to tesofensine. It sucks because tirzepatide is awesome. That's my favorite option. But of course, we'll let you guys know as soon as we hear. But even if, what I also heard was that FDA has started their process of saying, okay, Eli Lilly, you're saying that the national shortage is over. So now we're going to start our process of investigating that and confirming that, which would make sense. But no one knows how long that takes. And truthfully, I don't even know if that's actually, because that's not listed on the FDA website that we've started that process. That's just words to the grapevine. So those could be totally real or not. So this whole thing is just fascinating. And I think the takeaway is it's going to happen. And it's now we know it's happening sooner. That's the takeaway. That's all I can give you. Sooner means before I would say months, years, now weeks, months, just pretty wild. But anybody that's just starting this journey, you need not freak out because remember, we have semaglutide, tesofensine, but also the foundation of what we're trying to accomplish and why we're here is for this exact reason. We have much less to freak out in this community about because our goal has always been medication independence anyways. The goal and you guys are striving for as well is to just not let that affect you so much. And let's use this, guys, for even more motivation. If you weren't already trying your best to kick yourself in the ass and get really serious about this, let this be additional reason. Because like I said, we might run out of tirzepatide here pretty soon. And semaglutide still works. It's just not, it's a notch down. So just wanted to give you guys that. And I have yet to hear from some of my really plugged in contacts of some of the specifics that would probably tell me more. Are we weeks or months away? So you guys will absolutely get an update from me as soon as I get something solid. Everything I'm sharing with you guys is obviously more than hearsay, but nothing official from the FDA yet. So
shelf life.
Yeah. So compounding pharmacies have to put a certain date on all peptides. You guys have seen that. But as long as you keep peptides in the fridge in there, and you're not leaving it out for hours they go significantly beyond that best use date. What ends up happening beyond the best use date is you do start getting some degradation, and it is different per peptide, per medication. But for GLP-1 specifically, if you keep them in the fridge, the majority of the time, we're talking 4 to 5 months that, in some cases, even 6 months of some pretty potent efficacy. Beyond that, yeah, you start getting some market increase. They just legally have to put what they have to put on date wise. So totally up to you guys. If you want to stock up on tirzepatide, that's totally your choice. All these different names, we might as well learn these names. We learn this nomenclature. So semaglutide is the active ingredient of Ozempic and Wegovy. That's the first one that got famous. It's still really good. It's just tirzepatide is a little better, moderately better. So then we have tirzepatide, which is the active ingredient in Mounjaro and Zepbound. So this one is Eli Lilly. They're the ones that are coming out, and this CEO is pushing really aggressively because they lose money with the sale of these compounding pharmacies. And apparently they don't have enough money, and you guys all have to suffer for their greed, and they want to remove access from compound. It's crazy when you think about it. It's nuts because it ultimately is money. That's all this is. This is money and greed. This is all this is. And people have to suffer as a result of it. But yes, the more expensive versions, Mounjaro, Zepbound, which are the same thing. Unfortunately, the cost of those is usually about $1,500 a month, give or take. And so, yeah, it's just extremely pricey. And we can prescribe it, but we can't provide it. You guys have to go get it from a pharmacy and blah, 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 blah. So if it comes to that point, for sure, we'll figure it out and have access to prescribing that for you. But like I was saying, we still have semaglutide. But what really is the reality is if Eli Lilly really does this now, I can almost promise you Novo Nordisk will do the same, which is the maker of semaglutide. So like I said, I've always thought this was possibly 6 months to a year, 2 years down the line. But now that I see this really happening, if this really does happen here in the next month, it's got to be a few more months before Novo Nordisk does the same thing. So let's get serious, guys. Let's kick some ass. Let's build some medication independence now. Let's just assume the worst here so that we can be prepared. I thought it would be compounded with something else and it would be okay. So that's what they're currently doing right now. That's why you'll see various things that are compounded alongside the GLP-1s. That's how they can do what they're doing now. But in this situation, if it actually goes down, that wouldn't matter, because once the national shortage is over, that's the whole point of it, right? The compounding pharmacies won't be allowed to make it. Now, another sort of X factor in our favor is they're always trying to figure these compounding pharmacies are trying to stay in business as much as anybody else. So they're trying to figure out what they can do. And it's interesting because we also have the peptide stuff going on, which is the non-GLP, like the AOD and the CJC, and the FDA banned all those. But we still have compounding pharmacies right now that are apparently still, to give you guys the update on that, they're still rolling. The pharmacies that I work with, AOD, CJC, even though the FDA's banned them. So I think because you don't have massive companies behind AOD and CJC, you don't have this pressure to actually push the FDA to enforce this sort of stuff. But you do with GLP-1s. You have massive money behind the enforcement of any sort of law that ever gets passed, like AKA you can't do this. Once the FDA comes out with that, yeah, it's not going to be the same as, I still found a pharmacy that's willing to push the envelope on the AOD, CJC. Just wanted to give you guys some understanding of the difference so that you can make sense of all this craziness that's going on right now. What about the lyophilized powder? Can that be stockpiled for a while? So yes, in peptide world, in medicine, you can stockpile. That's the whole. So lyophilized, guys, is if you ever seen those bottles of peptides, that's when it's like that fluffy kind of dried up powder. So that can be stored for a very long time. But compounding pharmacies don't make the GLP-1s in lyophilized that I have ever been able to see. I've only seen those come from those research companies, which you guys know my opinion on research companies. Stay the hell away. Very sketchy. Do what you got to do. At the same time, I totally respect. I just would never condone that. And just because there's no way to know that you'll be safe getting compounding anything from a research company. So that's the only location that I have seen access to powderized, lyophilized GLP-1 meds. If you guys know of something else, please let me know and I will put a significant amount of intention, because that would be obviously amazing if I had something high quality right now, stock up on 2 years worth of GLP-1 if it's in that powdered form. So yeah, I haven't found that yet. Okay, so enough about all that nonsense. Let's get into some topics that we got to discuss here. Mark was asking about colostrum. Colostrum's good. It's pricey, but colostrum is very nutritious, very gut healing, and it's got a lot of immunoglobulins too as well. So it's got some effects on improving immune system function potential. I've never made colostrum a regular thing. How I feel, I try to separate mandatory from awesome. Like colostrum is definitely in that category where if you want to give it a shot, see what it does for you. Even if you don't feel anything necessarily, there's enough data behind it to know that it is promoting some gut health too as well. So I would certainly give it a shot if you want to see what it does for you. Okay, so somebody was asking about protein, unused protein being turned into fat. So let's talk about that, especially because I am in favor of over recommending your protein needs, right? So you've heard me talk about my recommendations of protein being between your current weight and your target weight in grams of protein. That's what we should be striving for. So 200-pound person who ideally should be weighing 150 should be consuming about 150 to 200 grams of protein. Now we know that significantly is much more than RDA recommendations, but they are so far behind the data. So do I think our body actually needs that much for just maintaining muscle mass and muscular growth? Probably not. I say probably not. But the problem is people always tend to underestimate their protein. That's why I've always been a little bit more like, just overshoot it. There's no dangers with slight overconsumption of protein. Now I know we're talking about, the question that was asked was, does it get converted into fat? And I'm getting there. With the exception of actual known kidney disease, which you'd be working with a nephrologist anyways. If you don't have that, any additional protein is just going to get converted into energy. Okay. Now let's connect it to fat. Any energy that you consume that's in excess, remember, energy is protein, fat, or carbohydrates. It's all, at the end of the day, energy, right? And if you end up consuming any amount of energy in surplus of what you consume, that will contribute to weight gain. And it's your hormones that dramatically influence what that weight and also what you're doing, right? Bodybuilders are a perfect example, but anybody that is gaining weight could be gaining all muscle, which is super good for you, right? If you're putting in the weight training, you're creating that stress, you're in a slight surplus, you're consuming adequate protein, right? That would be an example where you're putting on mostly muscle mass. But aside from that situation, if you're consuming excessive amounts of protein, but you're not really in a surplus, you're not going to gain body fat. So keep that in mind too as well. And the chances of over consuming protein and whether it's protein powders or meats in a way that puts you in excess of calories, it could happen. Don't get me wrong. It could totally happen. But the chances of overeating protein are significantly lower than overeating carbohydrates, bar none. You guys, even fatty steak, which is pretty calorically dense, how much fatty steak can you eat before you're sitting there going, oh my God, I am insanely stuffed? That's the thing. That's why ketogenic diets and carnivore diets, like we're talking about some fatty meats there and high amount of calories, but it's pretty challenging to overeat that compared to carbohydrates, which don't really hit the satiety center nearly as much. At the end of the day, don't freak out. Don't worry about extra protein. In almost every case, it's not going to be converted into fat. Technically could, just wanted you to understand that it very likely won't.